these awards here are to recognise the contribution of our healthcare scientists, pharmacy team and AHPs and all the achievements and all the work they do to improve patient care in Nottingham. I hope you enjoyed the first part of our event, mingling, seeing our sponsors and looking at some of the posters that show some of the work that we do. And also hopefully buying raffle tickets to raise some money for the charity. So the next part of the event is the awards ceremony. So we're going to hear from some guest speakers and then we'll see short video clips of the finalists before the award is announced. So just a little bit of housekeeping to let you know that the proceedings are being filmed by the Trent Simulation Centre and that will be available on their YouTube video for anybody who's missed the excitement. We also have some photography. That wasn't supposed to be sarcastic, sorry. It just naturally slid out. We also have some photography taking place, so there will be flash photography. I'm really pleased that we've had so much good support from the senior leaders within NUH to come and present the awards and be with us tonight. But also really pleased that we've had support from our professional leads nationally to come down and present our awards. So to kick us off, we've got our own Chief Executive, so please give a warm welcome to Tracy Taylor.
Hello and welcome to the 2019 Transforming Healthcare Awards. It doesn't seem 5 minutes actually since we were in this room last year, and I think I said then that I was absolutely bowled over by the innovation and the transformation that was demonstrated by you all. So challenge today, because actually I'm expecting it to be just as good, if not better. I'm really looking forward to hearing the outstanding achievements that you have achieved over the last year, hearing from our allied health professionals, healthcare scientists, pharmacy teams and the integral support and technical staff over the course of this afternoon, because I know that we will be really excited to hear what you have been up to. You are really a vital and hugely valued set of staff members in NUH, and hopefully this afternoon, by being here and hearing what you've been doing, we'll be able to demonstrate that to you. We are incredibly fortunate to have so many fantastic staff who work across NUH, and that includes all of you. I know later on we're going to hear about your presentations and winners, but actually, you know, fantastic congratulations and huge achievement to those of you who have been nominated, because really you are all winners by virtue of the fact that you are here today. These awards were established to celebrate your achievements and to recognise your important contribution to make the experience of our patients at NUH the best it can be. We have over 2,000 allied health professionals, healthcare scientists and pharmacy teams and support staff at NUH. And we wouldn't be able to deliver the services that we do to our patients without you. So thank you very much for everything that you and your colleagues do across NUH every single hour of every single day. The last 12 months has been a year of consolidation and further transition for us as Team NUH, and we focused on tackling some of our biggest challenges to ensure that we are set up the right way for the future, so that we can continue to deliver the outstanding health outcomes and patient and staff experience that we know that we already do, but we also know where the areas that we need to improve. Over the last year, we have truly seen what makes Team NUH special, with so many achievements and highlights throughout the year that we can be very proud of and very proud to celebrate. This includes our outcome of our CQC inspection, where we were rated good overall but outstanding for caring. This result has given our patients, their families and carers confidence that they can achieve and receive excellent quality of care at their local hospitals. But it's also been a real boost for staff who were praised for their determination to give the best possible care. When I met with the CQC inspectors, the words that they were describing our staff is absolutely recognisable when I walk out across the wards and through the departments. Kind, caring, compassionate, determined to do the right thing. Every time I'm out and about, I actually see that in abundance, demonstrated by everybody that you come across. And it's really pleasing that that was actually recognised by our CQC inspectors. For many of you, that you will know that they were here with us for quite a few weeks, and they were very intensive in terms of the inspection that they undertook. So huge credit to you. I think I've said this many times before. I think I might have said it last year. The most valuable asset we have in the organisation is you, our staff. It's you that are credit to the fact that this organisation is good and outstanding for caring. Earlier this year, we launched our refreshed Team NUH values, and also alongside that, associated manager standards. After listening to the feedback that you had given us and co-designing them with both our patients, our partners, and you, our staff. Our values are trust, empowering, ambitious, mindful, nurturing, united, and honest. They're also words that you recognise when you walk around our organisation, in addition to the ones that the CQC spoke to us about. You should be really proud the fact that you are demonstrating those values already. We know that there are areas that we need to improve, but actually that's about putting the icing on the cake and putting the gold knob on the standards that we really do already demonstrate across the organisation. Explicit in those values is the importance of celebrating our achievements and recognising our staff, which today's event is all about. And this is one of the ways that we will start to bring the values to life, because what we will do is hear today about not just the innovation, but how those values are a golden thread between all the thinking and the doing and the caring that you demonstrate each day. In recent weeks, NUH took on the important responsibility of running Nottingham Treatment Centre after a successful bid. In the months to come, we'll be working with our colleagues in the treatment centre to implement the transformation aspects of our bid so that we can further improve services for our patients and their families. Clearly, our therapists, pharmacy teams, healthcare scientists, allied health professionals and our integral support teams have a real key role to play in that transformation. We have a lot of good experience to share with the treatment centre, and we also have a lot of learning around how we can apply some of the things that happen in the treatment centre across the wider aspects of what we do at NUH. So now in year 2 of our strategy that we launched last year, and it's very clear that our top priorities for the year are a strengthened focus on Team NUH, to ensure that we actually do make real steps towards making NUH a really great place to work. Capacity, making sure that we right-size our hospital, including the beds, the wards, the staff. And value for money and best use of our resources. And that's about living within our means. You know, we don't have, an infinite amount of resources available to us. We never have had. But what we do is ensure that with those resources we do provide excellent care, deliver great health outcomes, and actually ensure that our patients have a positive experience. We need to continue to do that, and we can only do that with the great contribution of people like yourselves. So it's a really exciting time for NUH. It's a really exciting time for you to be part of our journey, and I'm absolutely thrilled at some of the impressive developments that have come out of the work that you and your colleagues have been doing. So without further ado, I'm going to let the proceedings begin. and look forward to hearing all about your great work. Thank you.
Right then, hi. For those of you that don't know me, I'm Judith Palmer. I'm the current interim chief pharmacist here at NUH, and I've got the privilege of introducing the first of our 6 awards this afternoon, which is the Chief Pharmacist Award. Before I then hand you over to Richard Cattell, who's our Deputy Chief Pharmaceutical Officer, who's been spending the day with us in the pharmacy department. I've worked at NUH in its various guises for more than 16 years now, and it's been a real honour over the last year to be leading a pharmacy team that I feel really quite passionately about. And the last year's not been the easiest for our department, with an interim leadership team in place. But I think what's really shown is how we've all pulled together, and it's been a real team effort. And in amongst that team, we've had some really good examples of individuals excelling at what they do day in, day out. And that was really clear in the nominations and in the finalists that we've seen for some of the awards tonight. So, before we see the 3 finalists, it's time to introduce Richard to you, who's going to announce who our winner is.
Thank you, Judith. As introduced, I'm fighting off the fact I'm 50, so I've got to take these off and put them back on again every now and then. As introduced, my name's Richard Cattell. I'm the Deputy Chief Pharmaceutical Officer at NHS England and NHS Improvement. We're now one big family in the centre and enjoying working together. I originally started off in NHS Improvement. I'm an acute trust chief pharmacist by background, had a go at being a chief operating officer the other side of the Midlands, over in Walsall and Dudley a few years ago. And I've spent the day, as Judith said, having a look at your pharmacy services. A large part of my job is supporting trusts like yours, actually not trusts like yours, but other trusts who are really struggling with care quality and helping them improve the way in which medicines are used. And that's how I go and support individual trusts who need that help. And I come and look at trusts who have got a good story and learn from them about what really good practice looks like. So I've been having a look and talking to some of your really good pharmacy team today about the stuff that's going on. I'm also responsible for things like supporting people like Judith, expanding pharmacy services over 7 days and supporting your patients, whether they're acutely ill or whether they need to go home in a safe and timely way, across the whole 7 days, and supporting people in pushing that. Something else that's really keen on is about developing a pipeline of aspiring chief pharmacists, people who want to be in the role that Judith is currently on, because it is a really good job. It is really enjoyable working for the NHS. I do miss being a chief pharmacist in a trust. And we're working hard to make sure that when Judith decides to hang her clogs up, if she ever does, that there are plenty of people around to support you going forward. I'm also responsible for setting up the medicine safety programme for the NHS. That's our response to the WHO's 3rd challenge. The first one being washing your hands and rolling your sleeves up. The second one being surgical site checklists, and the third one being medication without harm. So they've just set us the challenge of halving medication-related severe and avoidable harm over a 5-year period. And the thing that burns brightly with me, if you believe the evidence, 237 million times a year we get things wrong with medicines. 68 million times a year we hurt people as a result of getting it wrong with those medicines. And people like me and people like Judith and her team are here to help patients get the best out of them. Some of you will have seen this morning a report published by Public Health England about drugs that are liable to cause addiction, and some of the frankly quite worrying numbers. 1 in 4 people are taking more often than they should medicines that they may become addicted to, and we've got a really big challenge at hand to do something about that. It was a real privilege today to see some really good work around supporting patients going home, talking to people who will look after your patients once they've left your care, and talking to them about the changes that you've made, and particularly interested in some of the work you're doing around reducing the number of medicines patients are on. So de-prescribing, it's more important, I think, than prescribing in the first place, is taking some decisions about de-prescribing. So please continue with that. I've also seen some really good work around antimicrobial stewardship. It is really important, isn't it, that we look after the antimicrobials that we've got. If we don't, they won't work, and we'll be in somewhat of a pickle. So I've spent some time with your team today, and it was a real privilege to do so, and just a challenge to Judith and the team around the 7-day services challenge. I take Tracy's point on the chin about the challenging environment in which you are in, and I'll do all that I can from the job that I'm in to support Judith on that transformation journey. I'd also set a challenge about technology. Technology, I think, is a great route to safety, a great route to using the people that you've got in the best way you can, because you can back yourselves up with technology. And in the role I'm currently in, if there's anything I can do supporting you in your electronic prescribing, then please give me a kick about that, Judith and Tracy. And my phone's gone on security, so I can't see what I'm reading next. The other challenge is make the most of everybody that you've got. So I'm working with people within NHS England around what are the people consequences of the long-term plan, and how do we get the best out of the people that we've got and support them into jobs that they enjoy, are challenging and rewarding. And I would push Judith on that front, and I'll support her as much as I can. So thank you very much for the time I've had with the people today. It's been really good to explore some really great practice that's going on and understand what life's like, frankly, working in a modern acute trust like this. I've only been out of Worcestershire Acute for 18 months, but it already feels like 15 years. So it's really good to come and find out what reality is like. So without further ado, I'm supposed to ask somebody to start a video around the Chief Pharmacist's Award nominees.
My name is Tim Hills. I'm Interim Assistant Head of Pharmacy for Procurement, Medicines Information and Therapeutics, and I've been nominated for the Chief Pharmacist Award.
Tim is the lead pharmacist for antimicrobials and infection control. In 2016, the Lord O'Neill report estimated that by 2050, 10 million people each year will die from antimicrobial resistant infection. That's more than cancer and diabetes combined. Monitoring the use of antimicrobial drugs is one of the main ways this can be prevented, and is called effective antimicrobial stewardship. Tim developed an easy-to-use, interactive antimicrobial stewardship dashboard to improve the visibility of antimicrobial consumption across NUH. The dashboard also allowed users to filter antibiotic consumption by division, speciality and/or ward level, and it displays both over time and per calendar month to allow for seasonal differences. Consumption can also be split by product group and antibiotic drug into monthly or weekly usage. This dashboard allows the antimicrobial stewardship team to monitor trends in consumption, highlighting areas of high or increasing consumption. It also supports engagement with specialities and prioritise areas for audit and intervention. Over time, this project has the potential to prevent large numbers of deaths at NUH from antimicrobial resistant infections.
I'm Andrew Wignall. I'm a pharmacist working on PICU in Nottingham, been nominated for the Chief Pharmacist Award.
Andrew is a specialist clinical pharmacist working in intensive care and has helped enhance care delivered to critically ill children. Normal saline is often the first line intravenous fluid used with children. The fluid contains a similar concentration of sodium found in blood and so reduces the risk of neurological injury. However, it contains more chloride than blood, which may cause the blood to become more acidic and can lead to kidney injury. Plasma-Lyte is an alternative fluid which contains similar amounts of both sodium and chloride to that in blood. Using this fluid guards against both sodium and chloride imbalance in the blood, reducing the risk of complications. Mixing fluids with other medicines is common, and much is known about the safety of mixing medicines with normal saline. However, there was a complete absence of published information about whether medicines can be mixed with Plasma-Lyte, and was a significant barrier to the introduction of this safer fluid to paediatric practice. Andrew conceived and led a collaborative project to test whether or not medicines can be mixed with Plasma-Lyte. The results have been shared both nationally and internationally, and have allowed the introduction of Plasma-Lyte into paediatric practice, thus optimising care of critically ill children, both locally and much further afield.
I'm Alex Spurling, Senior Clinical Pharmacist for the Acute Frailty Pathway. I've been nominated for the Chief Pharmacist Awards.
Alex is a specialist clinical pharmacist in acute frailty medicine. Transfer of care around medicines is a nationally recognised project that aims to reduce the risk of medicines-related harm to patients during discharge, and at NUH this has been implemented by Alex. Pharmacists and technicians at ward level input a code into the electronic device software Notice, which is unique to the community pharmacy. Once the patient is discharged, information related to their medication on discharge is automatically transmitted to the community pharmacy using software called Pharm Outcomes. The community pharmacy then ensures the next prescription cycle relates to the discharge summary and supports the patient with changes to their medication regimens. The benefits of this project to the Trust and to patients is a reduction in readmission rates and future length of stay. Generation of 3,000 referrals per annum provides £1.6 million worth of cost savings to the Trust and CCGs. Patients feel more supported and are ultimately safer with this initiative in place. The project is aimed to simplify the referral process for our busy clinical pharmacy team. The pharmacy team now feel more engaged and understand the importance of referring patients on discharge. Alex was nominated for this award for his dedication and success in implementing this innovative medicine optimisation project.
Okay, the winner of the Chief Pharmacist Award is Andrew Wignall.
Say something if you like, Andy. You don't need to, no pressure. Do you want to or not? No pressure.
Thank you very much.
Okay, right, congratulations. So the next award is Rising Star, and this award recognises a special group of individuals whose records reflect ongoing and exceptional growth and contribution to their profession. They take on increased responsibility, proactively instigating new initiatives, and are hailed as a positive influence and integral support structure within their teams. And to announce our winner, we're delighted to have the Nottingham Hospital's Charity Chief Executive Barbara Cathcart, because their organisation is kindly supporting tonight's awards. So I'll hand over to Cath.
Thank you. It's an absolute honour and privilege to be here this evening and to help sponsor these awards. I mean, I actually never studied science in school. It's fair to say. I'm much more at the English thing. So it's really quite amazing that I've only seen 3 already, and I'm already blown away by what you all do. So this award is actually all about you and your successes and your contribution to this wonderful organisation, to the NHS, and to your patients. And as I said, science doesn't mean a lot to me, so I'm going to, in the words of your chief scientist, read what she says about her team of people here today. She says, "Our team at NUH is second to none in terms of expertise, compassion, dedication, and a driving passion to use their scientific knowledge to provide state-of-the-art patient care. I have seen so many examples of healthcare scientists pushing the boundaries to develop and introduce new technologies working to directly support patients." So she said it. I believe her. So without further ado, I thought that was kind of like an old-fashioned term, and I'm the third person to say it tonight, so I can't think of a more modern way. Without further delay, if we could please see the 3 shortlisted people.
Hi, my name's Lial James. I'm one of the Band 6 physios on Fracture Clinic, and I've been nominated for a Rising Star Award.
Lial is a new Band 6 physiotherapist working in musculoskeletal outpatients at NUH. In the past year, she has dealt with several complex and challenging situations with maturity and skill. One patient became unwell and went on to have a stroke whilst attending a physio appointment with Lial. Lial dealt calmly with the patient and coordinated her physiotherapy colleagues to assist. She also liaised with medical staff to arrange onward care for the patient. Another patient had a history of significant mental health issues, who had threatened suicide when physiotherapy treatment had been stopped previously. She demonstrated outstanding communication skills with the patient, liaising with mental health, security and safeguarding teams to ensure a safe interaction. Her ability to understand the patient's viewpoint and to communicate well ensured the patient was discharged without a problem. Lial has also performed an audit looking at changes in team productivity whilst implementing the 2-to-1 student supervision model. A poster of this was displayed at the EEE conference in June. Overall, Lial has great enthusiasm and aptitude for her work. She is an outstanding role model to others and is a real asset to the physiotherapy department. She's working above the standard one would expect at her stage of her career and has a huge potential for the future. Alex is an advanced practitioner physiotherapist and was nominated for this award by Karen Ward. Facial pain, headache and disorders of the jaw are collectively known as orofacial pain. Orofacial pain affects up to 1 in 3 people in their lifetime in the UK. In the Americas and Europe, physiotherapists routinely treat patients with orofacial pain, but this is not the case in the UK, as the management of orofacial pain is scarcely taught in physiotherapy undergraduate training programmes. Over the past 3 years, Alex has learned a number of physiotherapy techniques for the management of orofacial pain. He's also secured funding to create a dedicated part-time post as an advanced practitioner physiotherapist within the management of orofacial pain with the maxillofacial department at QMC. This is one of only 2 equivalent posts within the UK. Alex uses a combination of manual therapy, acupuncture, exercise therapy and psychoeducation to help this often complex cohort of patients. Alex has been in post for 12 months and the results are very positive. Many of his patients have had their symptoms for 5 years, and by the end of the 6 physiotherapy sessions, these patients are reporting an average reduction in their pain by 80%. Alex hopes in the future to teach more physiotherapists in the management of orofacial pain.
Hello, my name is Anna Lindstrand. I work as a specialist audiologist and I've been nominated for the Rising Star Award.
Anna has been nominated for the Rising Star Award due to taking a lead in the development of the audiology service for adults with dementia. She has established award teams to support inpatients with their hearing and hearing aids, as well as carried out training to ward staff to encourage deaf awareness and develop their practical hearing aid skills. She has also been a driving force behind supplying hearing aid boxes and batteries to hospital wards. At the outpatient department, she has developed dementia-friendly clinic rooms, which have enabled patients with dementia to get the most out of their appointment. Anna's continuing development of herself and her role means she is being sought out to talk at industry events, as well as invited to speak at national conferences. As a result of her work, Nottingham Audiology is now recognised as one of the departments in the UK leading the way for patients who are affected by dementia. Winning this award would be a great honour to Anna, and it would raise the profile of her work and enable her to keep improving the lives of adults living with dementia and hearing loss.
So, the winner is Alex Weden. Would you like to say something?
Thank you.
And this award was sponsored by the Queen's League of Friends. Thank you.
I've never heard Alex Weden say so little. For the more astute amongst you, you may recognise that I am not Liz Wilkinson. My name is Mike Bullock. I'm here to represent Liz, who offers her sincere apologies for not being able to attend this afternoon. Liz is obviously our Chief AHP for NUH, and she extends her thanks for everybody's dedication, AHP dedication and hard work over the last year. I've worked at NUH for 28 years and 3 days. Is that right, Nicole? But in the last year, I've had the huge privilege to work as operational lead for therapy and rehabilitation. And what that's done is give me a much broader appreciation of the AHP workforce. It's obvious that AHP groups consistently strive for excellent patient outcomes. They love solving problems, brackets, often in a crisis. They're genuinely committed to holding patients at the centre of everything that they do. They thrive on innovation and service improvements. All of the applications for the Chief AHP Awards have been superb, and I'd like to thank all the applications and everybody's hard work. Before we look at the finalists, I'd like to introduce Jo Fillingham, who's very kindly come to speak to us. Jo is the Clinical Director for Allied Health Professions from NHSI. Welcome, Jo. Andy. Thank you very much, Jo.
Thanks so much, Mike and Liz. As Mike said, hello, my name's Jo Fillingham. I'm Clinical Director of AHPs, and as Richard said before, in the newly aligned NHS England and NHS Improvement. It's a real delight to be here. I feel really privileged because I was here in June for the EE, or do you say Triple E, conference, and was asked to do a keynote there. And even there, I was completely blown away by the innovation, the dedication to improving patient services. I went back to the national team and was just singing praises, not only just in our AHP team, but throughout the nursing directorate and the medical directorate. Because one of the things I was saying to Mike about what I love about today and about that conference is that I get a little bit frustrated when I go to places and workforces navel gaze. We have got so much to learn across professions, and as I say, pinch with pride. I just love doing that. I love being inspired by other people's work. I'm not going to talk about what's happening nationally for AHPs, because for those of you who were at the conference, you'll know that, and those of you that know me know I've got a real open door policy, so you can approach me at any time and I'll tell you about all that stuff. But what I really wanted to talk about is another kind of thing that puts a fire in my belly and real passion, and that hopefully if you've read the long-term plan, I'm sure it's at the bedside of many of yours, and the interim people plan, and now we're working on the full people plan, is the golden thread for me across all these posters, the presentations, the videos that we've seen, everything that I saw at the EE conference is about leadership. You know, it's the real golden thread. I had an opportunity to have a round table with Don Berwick. If you know Don, is one of the senior leads at IHI. And he talked about latent leaders. Latent leaders are people who, they don't have leadership on their badge or leader. And it might not appear in their job description, unfortunately, but leaders at all levels, and certainly in the National Strategy for AHPs into Action, we talk about AHPs are leaders at all levels and can have the opportunity to bring about change. So in each and every one of the posters, in each of the videos, what massively sings out for me is about leadership. What we see from academic evidence, Michael West's work, et al., is that where we have the right leaders in the right place, it drives the right culture, we unleash transformative potential, innovation. And certainly through the work that we've done nationally with AHPs and the academic evaluation we did was when there is real strategic AHP leadership, it not only opens up the visibility and influence that AHPs have in an organisation, it connects them to the organisational values, and there is greater improvement in those organisations. So my call out to you is, please, for everybody that is driving such great work, please see yourself as leaders, even though it's not on your badge, and seek more leadership opportunities. So that's my plea to you of all the great work that you've done. So I'll use that wording again without further ado. Let's see the nominations and the great leadership on display.
Nicole is a clinical specialist hand physiotherapist working in NUH's burns and plastic surgery department. When patients present in ED with burns injuries, staff would contact the on-call plastics doctors, resulting in the patient having to wait in ED. Nicole developed a hand trauma triage clinic where patients are referred directly from the emergency department to her clinic and are given a timed appointment to reduce unnecessary waiting. Nicole assesses, diagnoses and treats the patients as necessary when they attend the clinic. She can order investigations, manage wounds, and provide steroid injections as required. She also lists patients for planned theatre lists, preventing unnecessary overnight admissions. If patients do not require surgery, she coordinates their ongoing care with physiotherapy, occupational therapy and nursing teams. This service has greatly improved both patient and staff experience and has saved NUH resources. It has raised the profile of physiotherapy within the burns and plastic surgery department and shown that physiotherapists are competent in diagnosis and management planning for trauma patients. In collaboration with the hand consultants, this service has been improved further by developing a hand trauma theatre list into which Nicole can list patients directly. This list runs on a weekly basis, therefore hand trauma patients do not need to fill the hospital emergency theatre lists or to block beds. Carolyn Costigan is a principal research radiographer at NUH. Carolyn set up a research and audit engagement programme for radiographers at NUH to develop a research culture and to help recruit and develop research radiographers. She set up a programme of monthly meetings on a range of topics and offered individual tailored support. This supported radiographers to develop research proposals or clinical audits and present at an NUH or national meeting in 2019. This programme used existing resources at NUH and did not require further funding, just staff time and enthusiasm. The benefits to staff have been improved engagement and job satisfaction, more confidence in engaging with research and audit and in clinical practice, and will hopefully see some radiographers develop clinical academic careers. All of the research and audits the group has carried out has benefited patient care, including projects to reduce radiation doses to children, accurate reporting of stroke scans, and working with radiotherapy patients with autism. Winning the award would allow Carolyn to present the fabulous work at NUH at the Radiography World Congress next year in Dublin.
So just congratulations to all those who submitted for the awards, congratulations to those nominees, but there is only one trophy, and the winner of the Chief Allied Health Professionals Award goes to Nicole Glassy.
Thanks very much, Joe. Nicole, any words?
Yeah, it's 28 years and 8 days, not 3 days.
Oh, sorry.
We started on the same day.
Oh, sorry. Massive congratulations to Nicole. I personally know the commitment that it takes to push professional boundaries of AHPs, to take on traditional medical roles. What you've done there is absolutely fantastic. It takes energy, it takes resilience, and it takes a lot of your own personal time in order to move something as far forward as you've done. So genuinely, huge congratulations. Our next award is the Team Award. Good. This recognises teams who foster collaboration, both within professions, but also in the wider multidisciplinary and professional context. This really defines Team NUH working. The award application showed fantastic examples of team working, which have all had an amazing impact on patients. And again, I'd like to thank everyone who applied. So to introduce our finalists, I'd like to welcome NUH Chief Nurse Mandy Sunderland to say a few words. Thanks, Mandy.
Okay, thank you, everyone. The light's a bit, isn't it? I've got them though. We'll be okay. So, 38 years and 14 days ago, I walked into a hospital in London to train to be a nurse. I was obviously only 5, as I'm sure you can appreciate, but it was the beginning of a lifetime spent as a nurse, working as part of a healthcare team. In my case, always in acute services, because that's my love, and I need to be in a hospital in order to feel complete, really. So in that 38 years, I've been around a bit, and I've worked in many places around the country, and I've had a huge privilege to work in the Department of Health, if you can call it a privilege, ladies and gentlemen, but I learned so much, but also to have been in many acute trusts. But the one thing I want to say this morning, or this afternoon even, is that none of them made my heart sing like NUH does. And the reason it does that is because this organisation and the talent that you come across every single day just sweeps you up. I've been here for 4.5 years now, and I can honestly say that this is the pinnacle of, and the proudest 4 years of my whole 38 years in the NHS. And the reason for that is some of the things that we've just seen in the last half an hour. People who are passionate about what they do, pushing the bounds of practice to make things better for patients. We know that when we're good, we're outstanding. CQC said that our caring was outstanding, and I think for me again, thank you NUH for giving me one of the proudest moments of my career. Not only that, this year we've won 5 Penner Awards, haven't we, Trish? Where's Trish? I saw her earlier. So are working in partnership with our patients, and some of you and many AHPs have been involved in some of the projects that caused us to win some of those national awards, like the memory menu. So we're doing really well this year. We have our challenges, like every large NHS trust does. But I think we need to focus sometimes, like this afternoon, on the things that we do better than anybody else. Those of you that have been around the nurses in the last 3 years will know about our magnet journey. Magnets taught me a lot. It's about aspiring to excellence and not being shy, because being British means that sometimes it's really hard for us to acknowledge that we're good at things. But also, it's been about working as teams, and I would really like to thank particularly AHP colleagues and our admin staff, our managers and leaders who've worked alongside us, because excellence is a team sport. The thing for me, though, the essence of Magnet and what it's taught me, is about bringing back joy at work. Because joy at work is so important. You spend a lot of time here, we all do, but having the ability to innovate, to make a difference, and to sometimes smile, well, all the time smile, and I think in NUH particularly to eat cake, is something that we should all put on the essential criteria in our job descriptions. So for me, once again, this is something that we do really well. Being able to celebrate here with you today and see the impact that you make and the innovations that you give. We've got NUH Honours coming up. We've got Nurse and Midwife of the Year coming up. I don't think anybody in the NHS celebrates as well as we do. You've only got to look at social media, and it's absolutely clear that NUH dominates Twitter. Those of you who may follow everybody, and in fact, some of my colleagues come up to me at meetings, national meetings and conferences, and always saying, "Is all you do at NUH have parties and eat cake?" I say, well, we do that, but we also work hard. So for me, thank you for doing what you do, and I'm loving these videos, Laura. These are going up on the Trust website, aren't they? Because I think everybody should see the difference that you make every day to patients. So thank you once again this afternoon for making me the proudest chief nurse in the world. So thank you. So, Team of the Year. Let's see the nomination.
nominated for the Team Awards.
The QMC gym and ED team rehabilitate patients who have undergone elective or trauma surgery and assess and treat patients who have attended through the emergency department. The team has continually worked dynamically and innovatively to pilot a telemedicine service for patients who have been referred from ED and are finding it difficult to re-attend following their injury. There were many organisational challenges to implement this trial, ranging from information governance issues to the administrative challenge of overhauling the whole pathway, but the team demonstrated a can-do and adaptable attitude to complete the project. The result of this pilot was demonstrated as a poster presentation which was presented at a local conference. The team has been consistently dynamic to change within the department, as they have created several new processes, such as a friendly competition to complete the friends and family test that was incentivised by chocolate, and the creation of a database that collects all patient outcome and experience measures of their treatment. The team has demonstrated its adaptability to help other clinical areas in times of need, ranging from helping out on orthopaedic wards or to offering portering assistance to take patients from ED to the wards to improve hospital flow. The team is enthusiastic, flexible, caring, and they are an asset to NUH.
Hello, we are the Bowel Cancer Screening Symptomatic Fit team.
The Bowel Cancer Screening Hub Healthcare Science Team helps screen the population for bowel cancer. As part of the National Bowel Cancer Screening Programme, the team were aware that there is a new, more sensitive and specific test that could be offered to those individuals with vague symptoms of disease to help triage them more appropriately. The Healthcare Science Team carried out a pilot study with the colorectal team at QMC, Nottingham CCGs and Cancer Leeds to investigate acceptability and utility of this new test in an urgent referral pathway. Results showed that the new test, called FIT, is acceptable to patients, has very positive readings for predicting colorectal cancer and other significant pathologies. It is also successful in identifying those with very low risks of disease, who can be sent back to their GP for more appropriate, less urgent follow-up. This test, therefore, benefits both patients and NHS trusts, both in terms of appropriateness of treatments and compliance with cancer wait times, along with an added bonus of saving valuable resources. A FIT test is cheaper than imaging or a colonoscopy. This test has consequently been introduced into the referral guidelines for Nottingham GPs and has been adopted by Leicestershire, South Derbyshire and Northampton and Kettering CCGs using NUH facilities due to the high quality accredited service. This provides additional jobs and income to NUH. The Healthcare Science Team has played an integral role in delivering this service improvement both here and for the wider East Midlands area.
We're Radiotherapy Physics and we've been nominated for the Team Award.
Radiotherapy is an essential part of treating many cancers. NUH recently purchased RayStation, a new radiotherapy treatment planning system at a cost of £1.5 million. The team created a model of the Trust's 5 matched radiotherapy treatment machines in RayStation, then tested this by creating complex treatment plans and delivering these to a measurement device. The initial results were unacceptable, with the measured dose varying by up to 6% between different machines, which would mean that patients had to be planned, scheduled and treated on the specific machine. This causes undesirable gaps in treatment on days when that machine is being serviced. The team were nominated for their work in refining the beam model and planning technique in RayStation to enable complex plans to be delivered on any machine. In order to do this, a computer program was written to calculate the complexity score of individual plans. The plans were remade with efforts to make the plan less complex but still good enough quality. The new plans were measured on every machine. The beam model parameters were then adjusted in an iterative way to improve the agreement between calculated and measured dose across all machines, until all results were within 2%.
See what I mean? Wow, I didn't even understand any of that last bit. So, good Lord. I'm so impressed. Right, so the team award is Radiotherapy Physics.
So I was quite a small cog in that project, but the rest of my team are all on leave, so I get to come and take the glory. So thanks very much. But I do work in a really fantastic team in radiotherapy, and it's a real privilege to work in such a supportive atmosphere. And it's not just the scientists, it's the radiographers, the doctors, the engineers. It's just a really great place to work. So I'm really glad it's been recognised through this award. So thank you.
And well done, Radiotherapy Physics, an ability to communicate for 5 whole minutes without anybody in the audience understanding most of what you say. Strangely, I get a real buzz from seeing the technology and seeing the clever stuff that people do, a real thrill from seeing the analysis machines going through. When I was young, I used to watch Play School. I don't know if anybody's old enough, and I always used to like it when they went into the factories and showed how things work, and I think that's remained my passion. So we move on to the Chief Scientist Award, and I can't explain, this is the 3rd year we've run this, quite how rewarding it is in my role just to hear all the great things that our scientists are doing across NUH in all the divisions, and the real difference it actually makes to patient care. So our shortlisted scientists talked about some improvements in cardiac imaging that helped maintain image quality so we get really good pictures whilst reducing the radiation exposure to patients significantly. Improvements in the systems we use to manage medical devices so that our clinical teams have the equipment that they need in the place they need it at the right time, and that we optimise the cost associated with replacing that. New computer programs written by our physicists in radiotherapy physics that make planning complex radiotherapy plans much more simple and safer for the radiographers. And improvements to the analysis techniques in bowel cancer detection, both for the bowel cancer screening and for the symptomatic, as you just saw. And sometimes when you work in an area, you start to take these sort of things for granted. You just think that's the sort of work everybody gets to do every day. And I don't know if you know, when we judge these awards, we have a diverse judging panel with patients, people from divisional teams, people from the charity, all part of that panel. And actually when you get to hear some of the comments from people on the judging panels, it actually makes you see it through fresh eyes, how great this work is that we get to do, and actually what a privilege it is getting to do something that you really enjoy every single day. So, I'm really proud to be part of healthcare science at NUH. But to introduce our 3 finalists, I'm really thrilled that we've got Catherine Ross from the Clinical Leadership Lead from the Office of the Chief Scientific Officer.
I'm going to start off by saying I feel extremely privileged just to be standing up here after seeing the radiotherapy physicists, because whenever you hear people in the audience say, I didn't quite understand that, and where we're thinking, wow, that's what we do every single day, and that's so cool. So thank you very much, Claire, for inviting me here, and obviously I'm a bit of a science nerd as well. As Claire says, I am the head of workforce and leadership at the Office of the Chief Scientific Officer at NHS England and NHS Improvement, and 2 of probably the most critical pieces of work, and I'm leading the healthcare science people plan. I was going to do, after Jo had said about the long-term plan, I thought I might do a pop quiz now, since you all nodded when she said you must have that on your bedside cabinets, but I'll spare you that. But like many of you in the audience, I am actually a healthcare scientist. I am a clinical scientist, specifically in cardiac imaging. So I understand exactly what we do here. But I also understand that what I hear from a lot of our healthcare scientists is we're the hidden workforce. We do all these incredible things, but no one sees us doing them. And I had the word golden thread earlier, so I'm going to use my golden thread. But we are the golden thread. We are through every single patient pathway. We start at prevention, diagnosis, treatment, intervention, and rehabilitation. And we touch absolutely every single bit of that. We are critical in every part of the patient pathway, and yet we consider ourselves hidden. And that's one of the fabulous things about being here today with all of you, is the fact that you're really singing the achievements of what sometimes can be very much hidden roles. But actually, I didn't write anything down to begin with, and everyone else had speeches, and I thought I must write some stuff down. But as a profession, we have such a critical offer to the next generation, because we as healthcare scientists combine not only a passion for science, but also a passion for wanting to work in healthcare, and that's actually quite unique. But what we probably lack overall is a real professional identity. It's what the nurses have done incredibly well. They're a nurse first and foremost, irrespective of the specialism within nursing. And actually it's something that we need to build upon. And I know that Claire has done some exceptional work here, and we'd be really keen to try and emulate that across the country. But as a family of healthcare scientists, we probably don't always know our cousins in biochemistry or medical physics or respiratory physiology. And that's something that I know Claire has worked very, very hard here, but something that we probably need to start doing more often. And when we introduce ourselves, we should be saying, I'm a healthcare scientist specialising in, rather than saying I'm a clinical biochemist or a radiotherapy physicist. And one of the visions I would have for sort of a national team is around us developing a proper professional identity. I'm not going to stand up and say too much, thankfully. But what's really lovely today is the fact that we can stand here as healthcare scientists with our pharmacy colleagues and with our allied health professional colleagues in a very multidisciplinary team way to really, really appreciate the effort that every single person in this trust, and it seems to be, from everyone I've met today, it's a real family environment. I love the cake. It seems to be the thread throughout the place. But it is really, really nice to be here and actually to see just how your three chiefs have such a real cohesive bond to bring everyone together and really to celebrate success. So I feel exceptionally proud to stand up today and be able to present the Chief Scientist Award. So without further ado, I get to say that, we're going to watch the videos.
Talitha Smith and Chief Scientist Award.
900 patients a year have urgent palliative radiotherapy at NUH to treat cancer symptoms including bleeding, pain and spinal cord compression. Radiotherapy plans are prescribed using radiation dose at a single point on the body. However, defining this point in our computer software, RayStation, involves several time-consuming steps and many opportunities for error. Talitha's work automates appropriate processes to streamline this workflow to reduce the waiting time for the patient. Talitha uses the RayStation programming interface to automate and combine steps. This has meant calculated coordinates for treatment are placed more consistently, as opposed to added manually using a computer mouse. It is also positioned more quickly and accurately than most users could achieve. Automating suitable parts of the workflow allows staff to concentrate more on other aspects, and also means staff can create a treatment plan more quickly with reduced potential for error. Patients will have a shorter wait between CT scan and treatment delivery, particularly important for patients waiting in the department. Approximately 1,000 patients a year will benefit from this new workflow. Winning this award would allow Talitha to attend educational meetings aimed at improving the way we develop and maintain in-house computer software.
Hello, we are the Bowel Cancer Screening Symptomatic team, and we've been nominated for the Healthcare Science Award.
As the Programme Manager of the Bowel Cancer Screening Hub, Caroline has led on implementation of new screening tests for bowel cancer. As part of the National Bowel Cancer Screening Programme, the team were aware that there is a new, more sensitive and specific test that could be offered to those individuals with vague symptoms of disease to help triage them more appropriately. The healthcare science team carried out a pilot study with the colorectal team at QMC, Nottingham CCGs and Cancer Leeds to investigate acceptability and utility of this new test in an urgent referral pathway. Results showed that the new test, called FIT, is acceptable to patients, has very positive readings for predicting colorectal cancer and other significant pathologies. It is also successful in identifying those with very low risks of disease, who can be sent back to their GP for more appropriate, less urgent follow-up. This test, therefore, benefits both patients and NHS trusts, both in terms of appropriateness of treatments and compliance with cancer wait times, along with an added bonus of saving valuable resources. A FIT test is cheaper than imaging or a colonoscopy. This test has consequently been introduced into the referral guidelines for Nottingham GPs and has been adopted by Leicestershire, South Derbyshire and Northampton and Kettering CCGs using NUH facilities due to the high quality accredited service. This provides additional jobs and income to NUH. The healthcare science team has played an integral role in delivering this service improvement both here and for the wider East Midlands area.
I'm Kenneth O'Dowd. I'm a clinical scientist working in diagnostic radiology and radiation protection, and I've been nominated for the Chief Scientist Award.
Optimisation of imaging procedures is a core work activity for physicists working in diagnostic radiology and radiation protection. The purpose of optimisation is to ensure patient radiation exposure is kept as low as possible while providing adequate image quality. Kenneth led a multidisciplinary team project, including radiographers and spinal surgeons, to optimise the radiation exposures for paediatric and adult patients during spinal surgery. The project centred on a mobile CT scanner used for the paediatric scoliosis correction. This device has been shown to produce better surgical outcomes when compared to alternatives for image guidance, but has the potential to deliver relatively high levels of radiation to the patient. To test a new protocol, Kenneth used a phantom dummy which simulates the impact of an X-ray on a real patient and is imaged using the mobile CT scanner, with the images viewed by members of the surgical team. Based on their assessment of image quality, the patient radiation exposure could be reduced by 80% compared to what's produced with the existing manufacturer recommendations. As it's not ethical to directly relate model-based work into clinical protocol, current reductions of 55% have been achieved with most recent patients. These are now routine use at NUH, and the work is being shared with other users of the system. Kenneth plans to continue progress with further reductions in patient radiation exposure.
And before I actually give the award, I'm going to suggest that everyone who was nominated for the Healthcare Science Award was actually a winner, and I'm just glad that your Chief Executive and the Chair of your board is here today, really to see just how fabulous a contribution healthcare scientists make within your trust. Unfortunately, there's only one winner who gets a trophy today, but that is Kenneth O'Dowd.
Hi. Really want to just thank Matt Dunn, who's sitting up there, for his nomination and support in the project and advice, and members of the radiology team and the surgical team. Thanks.
So, very well done. It was a very competitively fought award with some really high standards, so that's really great to see Kenneth win. But I think what you'll find, the golden thread is the golden thread tonight, isn't it? But we can do clever stuff in healthcare science, but actually us doing clever stuff in a room on our own doesn't really achieve very much. But that really transforms into great quality patient care when we do clever stuff in with a multidisciplinary team. So it's that, and all these awards tonight involved interactions with different professional groups, and that's what actually brought the transformation. So moving on, this is the last award, the Extra Mile Award. So this award recognises staff that have performed above and beyond normal expectations in specific and recognisable ways. They demonstrated a commitment to their profession which strengthens their team and provides outstanding performance. At times it can feel like these sorts of individuals keep our NHS going. So to announce our finalists, I'm delighted to hand over to our very own NUH Chair, Eric Morton.
Wow. It's been amazing what we've seen so far. I mean, I'll make a confession. I didn't start in the NHS. And I got into the NHS almost by accident. I'm an accountant, but I've recovered. I'm now perfectly well. I managed to get over it. But I joined the NHS because I thought I ought to do a couple of years in health to see what it was like on my CV. And I went native. And I couldn't move out afterwards because, as you all know, and you found out a lot earlier than I did, it gets to you. And it becomes somewhere that you want to work. And it's a place where you can go as far as you want to go. You can expose your skills as much as you want to expose them. And what we've seen tonight are people pushing the boundaries. And good organisations push boundaries. I worked in a lot of organisations, and the last few I've worked in for the regulator, I've got over that as well, was in trusts in special measures. And when you see how staff there are struggling to get any innovation because they're peddling to try and do the best that they can, and it's often not their fault. It might be somebody's fault, but it's not their fault. And when you look at NUH, you look at a place that just oozes ambition. You look at a place that provides fantastic services way beyond Nottingham, way beyond Nottinghamshire. You look at exceptional staff who want to do more than the JD says, more than the job description says. We see that up here, and I think that's kind of fantastic. And what I do think is also of tremendous value here is the way that you've all come together. It is very, very unusual in hospitals, as you know, to bring these professions together because you're so stronger together. And I think your three colleagues down here have done a fantastic job in moulding you into what is a really recognisable unit that provides outstanding clinical services. And yet, the point's well made, you all ought to look at yourself as a single profession. You've got special interests, just as nurses have special interests. But the work that you do is fantastic, and often we don't see it. I mean, I've managed to get around. I've been to the therapist meeting. Claire came to the trust board. I'd not been there very long, and did a presentation on what you do. And I came out and said, bloody hell, I didn't know all that was in there. Jesus, that's really impressive. And everything I've seen today just points to the fact that you are pushing the boundaries. And what I'd say to you is, keep pushing. You've got to lead with your heart. You've got to push on, because it's in the hands of people like yourselves that will make progress, that will provide better patient care, and that will do what our population wants us to do, and that's provide a hospital of which they can all be proud, and you can be proud to work in it. And I think you should go away from tonight feeling really, really good about things. Not many hospitals have award ceremonies anymore. They're one of those things that fall by the wayside because times are tough. They must never fall by the wayside, because we need to stop occasionally and just say, wow, people have done well. We need to stop and celebrate. We need to pause, and we need to look at award ceremonies like this, and the Long Service Awards, and the Volunteers Awards, and the Nursing Midwifery Awards, and NUH Honours, and be proud of what the people who work in this organisation can do, because they're all stars. Tonight, we're looking at a specific area. The people who are nominated and who have won are, at the moment, the ones who are being nominated and have won, but below them are people who are working equally hard, equally pushing the boundaries, and we owe a debt to them all. Now, one of the benefits in being last on is because when you're a chair, they don't trust you to pick up the wrong award. So there is one award left, and I'm not going to say without further ado, I'm going to say something I've always wanted to say. Run VT.
Hi, I'm Liz Jameson. I'm an advanced pharmacist practitioner, and I've been nominated for the Going the Extra Mile Award.
Every day, staff across NUH inspire their colleagues through their skills, dedication to their work, and their passion for excellent patient care. In the pharmacy department, this is embodied by Liz. Within critical care, Liz is an integral part of the multidisciplinary team, taking a key role in prescribing, advising and managing high-risk medicines in critically ill people. Liz sets exceptionally high standards of clinical care and delivers improvements in how care is delivered within critical care. She is an inspiration to her colleagues and exemplifies what a clinical pharmacist should deliver. Liz also provides management and pastoral support for the 24 junior pharmacists and is unfailingly available whatever other pressures she has to manage. She's always available for advice, support, and to review difficult situations with our team being called on at home at any time of the day. She both protects and motivates our junior staff to become better pharmacists, and there are countless pharmacists who would list Liz as an inspiration in their career. The number of junior pharmacists that have come through our service and who have been inspired by Liz is impossible to count. The National Scientist Training Programme sees new healthcare science trainees from across the country join us at NUH every year. Cara has been instrumental in setting up and maintaining the running of the new Trainee Healthcare Scientist Network at NUH. The group was founded in June 2018 to welcome new trainees to life at NUH. It introduced them to the wider trust and provided support for trainees throughout their training. This group brings together trainees from across all divisions within the Trust and will have a real long-term impact on patient care delivered by this varied and extensive group of staff, helping them develop communication and patient care skills through professional practice workshops, encouraging them to work across interdisciplinary boundaries and putting NUH's values and behaviours at the heart of their clinical practice. CARA has already organised and hosted multiple events through the trainee network, including a yearly welcome event for trainees to help orientate new arrivals and introduce them to a working life at NUH, and a mock examination day for second and third year trainees. The network now regularly hosts bi-monthly meetings for trainees to discuss their practice, share experiences and support professional growth. This aims to lower staff stress levels, improve well-being and promote CPD, and share knowledge of departmental practices in order to improve future interdisciplinary communication within healthcare science. Cara's passion for supporting the progression and well-being of others around her has driven this group forward, and it continues to go from strength to strength.
Okay, my name is Tracy Booth. I'm the audiology support worker and I've been nominated for Going the Extra Mile.
In December 2018, Audiology ran its own in-house awards. Nominations were open to all staff and Tracy received the most nominations by far. The department feels Tracy is an integral part of the team, but worry that she doesn't fully appreciate how much she contributes to its success. To quote some of the staff, "We would all be lost without Tracy. She regularly goes out of her way to help others and is always there for any kind of support, be it emotional or clinical. She also gives excellent advice and always makes me feel better if I'm having a bad day. Her willingness and warm personality make her an asset to our department. Her skills do not just end with her office admin work, but her cheerful and warm personality is projected to patients and staff. She is a great team player. She works hard and it always tries to lift the spirits of those around her. It's not surprising at all when we are confused and the first advice we hear is, 'Ask Tracy,' or 'Tracy would know,' or 'Wait till Tracy's back.' It's incredible to see what she does for the department, and for someone who always goes above and beyond, we would like Tracy to know that we appreciate her hard work and her contributions, and that they do not go unrecognised.
Three amazing nominees, and they're all winners. But the person who's getting the award tonight is Liz Jameson.
Thank you very much. It is a privilege to be recognised and valued for all that you strive to do. Clearly I was sitting on winner's row there, there's three of us on winner's row. I'm really lucky to be part of a fantastic adult critical care team and a junior pharmacist team that continue to inspire me after over 20 years to still want to be the best we can be. So thank you very much.
Right, that concludes the presentations, and a huge congratulations to all applicants, finalists and winners. It's been a fantastic event ceremony and a great support, to be noted, from Nottingham Hospital Charity. Without their help, we really wouldn't be able to run this. I'd like to also thank the following sponsors: Oncology System Limited, PTW, Brown Jacobson, League of Friends at the QMC, and also a big thanks to Medical Photography to help capture the event, and the Education and Conference Centre for hosting us. The other thing to say is I've been absolutely blown away by the quality of the videos today. They've been absolutely marvellous, and so credit to the Trenton Simulation and Clinical Skills Centre. We're going to finish by hearing a few closing remarks from Tracy, but before so, we have the excitement of the raffle. Whoever put me in charge of a raffle, I have no idea. Tracy, would you mind coming and doing the honours? So we have three prizes. So the first one being Panto tickets to see Cinderella at the Royal Concert Hall.
81, Anna Lindstrand.
Ah, fantastic. Come on down. And the next prize is a Glasses time back massage from the Beauty Temple. Sounds good.
Got two, sorry about that one. Number 203, Cara Mackenzie.
And then finally, a signed copy of the Great British Menu Cookbook, signed by Sat Baines. And if you look at the signature, he should really have been a medical consultant. It's absolutely legible.
Oh, yeah.
It's terrible, isn't it?
Number 118, Lizzie Robertson.
And one final thing to say is massive thanks to Ruth Bunn, who has yet again pulled out all the stops to do arranging, preparation. Just, she's been absolutely fantastic. So could we just give Ruth a huge round of applause, and as a token of our appreciation. And over to you, Tracy.
Thank you. Well, wow. I don't know actually what to say, because I set you a challenge at the beginning to match or exceed the great things that we saw last year, and as if there was any doubt about that, you have exceeded that by far. I'm not really sure where we're going next year with this, because we've seen some fantastic things today. Thank you so very, very much for all that you do. I mean, I think a number of people have said you are all winners here today. There's a few of you that have gone away with a trophy, but you are all winners. These awards are really a tribute to the professions that you represent, and we need to ensure that we really do as much as we possibly can to raise the profile of you and the work that you do across NUH. If you have any ideas, please let me know. We've heard some, the fact that a lot of the work that you do is behind closed doors. You're not necessarily at the forefront of what people see, but you are most certainly at the forefront of innovation and transformation. It's been an absolute privilege to hear about the work that you are doing. Some people say, unsung heroes. We've definitely been singing today, and I'm sure that singing will continue. It was absolute privilege as well. I was watching the awards, and all bar about one or two, I visited all those departments, and therefore have had the privilege of seeing what happens in those departments and the work that's going on firsthand. I've also had the privilege of being an inpatient here this year, and I say a privilege because whilst I was extremely unwell, I actually experienced the absolute dedication and fantastic care that our patients receive. I had brilliant care from the consultants, from the nurses, but the one person that made a huge difference to me was the physiotherapist. And I think that very often we don't recognise that, because we see the nurses, we see the doctors, and I have spoken to that lady and told her that, it changed my life actually. And I think we have to really really think about how we do start to recognise the hidden gems that we have in our organisation, that is you. So many, many, many congratulations again from me and from the board and all the senior leadership team here at NUH. You really are the stars today of NUH, and I really do look forward to hearing about what the next 12 months brings for you and the colleagues working here. So thank you very, very much for inviting me here today, and well done and have a lovely evening.